Hello and welcome to our presentation on the Illinois Physical Therapy Supervision and Delegation. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The therapist's role is the interpretation of referrals, evaluation procedures, or the planning or major modification of patient programs. PTAs may perform patient care activities under the general supervision of a licensed PT. PTAs may not interpret referrals, perform evaluation procedures, plan or make major modifications to patient programs. General supervision. The PT must maintain continual contact with the PTA, including periodic personal supervision and instruction to ensure the safety and welfare of the patient. Failure by the PTA and PT to maintain continued contact, including periodic personal supervision and instruction to ensure the safety and welfare of patients, is considered to be unprofessional conduct. A physical therapy assistant shall use the initials PTA in connection with his or her name to denote licensure. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. Physical therapy aides may perform patient care activities under the on-site supervision of a licensed PT or licensed PTA. Patient care activities shall not include interpretation of referrals, evaluation procedures, the planning of or major modifications of the patient program. Aides should be clearly identified as a physical therapy aide or PT aide in a clinical setting. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.